Greetings, sisters and brothers, friends. Welcome to the Toronto and York Region Labour Council's Day of Mourning ceremony. My name is John Cartwright, President of the Labour Council. You know, this has been a very tough year. Across the world, thousands have lost their lives, millions more have been touched by the COVID-19. Today you'll hear speakers talking about the experience of frontline workers, whether they're in healthcare, providing food or essential services, or those who risk themselves on a day-to-day basis. It's been 60 years since the Hogs Hollow tragedy sent shockwaves through Torontonians because of the senseless loss of lives in construction. Those losses continue today. We ask everybody, as we go about our day-to-day work, that you practice social distancing that our health professionals are telling us is so important. But most importantly, we ask you to be safe and remember those who've come before us. Thank you for joining us.
Hi, my name is John Taylor, and I'm the Mayor of the town of Newmarket. I'm pleased to join you today on the 2020 National Day of Mourning. This is an important day in our calendar year, a day where we recommit to our efforts to provide a safe and healthy workplace for all employees. This is also an important day for us to mourn the loss or injury of people in the workplace. So today I join with all of you to remember and to mourn, but also to commit to a better future. Thank you.
Today I stand in solidarity with workers across Ontario and Canada in marking the National Day of Mourning. During the COVID-19 pandemic, we are especially thankful for essential workers, healthcare workers and public health staff, first responders, pharmacists, grocery store staff, farmers, truckers, supply chain workers. And we're especially sorrowful for those of them who have been infected by COVID-19 at work. We mourn the loss of people who have died from this terrible virus and remember that even during this extremely challenging time, every workplace death is a preventable death, and every worker has the right to protection and safety at work. No exceptions. On this day of mourning, I'm launching the fight to ensure that all workers during this pandemic have presumptive coverage for COVID-19, both for the virus itself and for the trauma, PTSD, and mental health challenges that may come after it. As we mark the National Day of Mourning, we remember the dead and fight for the living.
Greetings. My name is Jackie Walker, and I'm the Nursing Division President at SEIU Healthcare, where we represent over 8,000 frontline nurses and 60,000 frontline healthcare workers. Thank you to the Toronto York Region Labour Council for inviting me to share some words at your Day of Mourning ceremony. It truly is an honor and a privilege. This year, the Day of Mourning ceremony and the Day of Mourning is resonating with so many of us, as we know frontline healthcare workers are being put at risk each and every day by their employers and the government. We should not need to say this, but every worker who goes to work should return home in the same health in which they left. DSWs and PSWs should not need to beg for PPE. Nurses, RPNs should not need to beg their employers and the government to protect their residents, clients, and patients. We shouldn't need to say any of this, but unfortunately, because of a lack of proactive measures on behalf of the government, provincial government, and the employers, this isn't happening. Each and every day, frontline workers are being exposed. They're being infected, and some have died, and more will continue to die. From the very start of this pandemic, we have been demanding the government and all employers provide PPE based on the precautionary principle. This is the principle that we should not await scientific certainty until we take reasonable measures to prevent risk. Our immediate demands to government was that they provide PPE, that they increase testing for frontline workers, that they provide mandatory training in the donning and doffing of PPE, and that employers and the government provide transparency to workers so they know the level of risk in which they're entering when they go to work. We know that over 10% of the people of Ontario who have been infected are frontline healthcare workers. They are not being protected. SEIU nurses have been calling for the hierarchy in healthcare to be addressed systemically. Healthcare workers in every sector, in every work environment, should be provided with the same access to PPE. Directive number 5 initially only took into account RNs in the hospital sector. This excluded nurses up to 55% across our province. This was a direct attack on both unity within our profession and workers' rights to be protected. When frontline workers are not protected, neither are our families or our communities. SEIU is committed to standing shoulder to shoulder with all who want to see this change. To all the frontline workers, for everything that you do each and every day, thank you, and I pray for your protection each and every day. To all that have been injured or fallen ill, I pray for your speedy recovery. We will need you to join all of us and all of those who have lost a loved one, all of those who have lost a loved one to workplace injury or illness. We are calling on you and your resilience and your deep connection to this issue to stand shoulder to shoulder with SEIU and our labor movement in Ontario. We will not sit down, we will not lay down, we will not take no for an answer until each and every frontline worker is provided protection and is respected. Thank you to the Toronto York Region Labour Council for having me today, and I pray for safety for each and every one of you who are out there each and every day. Thank you.
Hi, I'm Willie Noelle, the Executive Vice President of the Ontario Network of Injured Workers Groups. Together with our President, Janet Patterson, we thank you for the opportunity to have our voices heard today. But we're here today via video or audio to remember the living and to honor the ones who have already paid the ultimate sacrifice. While many are at home practicing social distancing as required by public health, there are many frontline workers who put themselves at risk each day in the healthcare sector, in grocery stores, at gas stations, delivering food, or sadly working on a construction site. We call these workers heroes. But if they develop COVID-19, WSIB will only commit to reviewing their claims on a case-by-case basis. We all know what that means, and that shouldn't be. If you're a healthcare professional or working in a grocery store and you develop this coronavirus, it should be presumptive that you contracted the virus while working. When someone is recovering from COVID-19, the last thing on their mind should be having to fight the WSIB to have their claim approved. They should be treated as the heroes they are and their claims accepted. Because unfortunately, we don't know whether there will be after effects once fully recovered. So even though the WSIB and others may tell these sick workers to just apply for the Fed's emergency benefit, we urge workers to file a claim just in case there are ramifications on their health in the future. Today, we also think of the many workers who've already been injured and have reached maximum medical recovery. As Oniwig, we had asked the WSIB to put any deeming on hold as we deal with this unparalleled public health crisis, because even WSIB shouldn't be able to pretend that there are jobs out there. But still, they denied this request, as well as every other suggestion us and the labor movement and the injured workers community legal clinics had made. So today, Oniwig recommits to working with labor and others to press the WSIB to truly care for injured and sick workers once and for all. We also continue to pray for all frontline workers. And again, thank you for allowing us to speak today.
My name is Catherine Grzeszczak. I'm the president of QP Local 905, representing 6,000 municipal and library workers across York Region and New-Tecumseh. I'd like to recognize a local 905 worker that we lost this past year. Wade Harkin was a seasonal worker for the city of Markham, and while he was away from his primary job, he died in an accident working at a private ski facility. Wade left behind his wife, who was pregnant with their first child at the time. In the midst of the COVID pandemic, we are reminded of the importance of workers having an organized voice to push for their right to health and safety. Public health data shows us that healthcare workers make up over 11% of the COVID cases in the province. That is far too high. It is vulnerable communities that are affected when workers who take care of them get sick and can no longer come into work. And while the provincial government keeps claiming that there is no PPE shortage, we're seeing frontline workers speaking out in the media about being given one surgical mask as sufficient personal protective equipment for a 12-hour shift. The news is filled with work refusals by essential service workers who are stopping work to protect themselves from the virus. And while the Ministry of Labour is not upholding these work refusals, we can see that it is only unions that can be counted on to protect workers. Decades of austerity have led to a situation where the healthcare system has little capacity to accommodate any increase in need for service. Underfunding to hospitals means that some hospitals were running over 100% capacity before this pandemic. Long-term care workers have been asking for increased staffing for decades. The long-term care sector is predominantly run by private providers that have maximized profit at the expense of the well-being of residents and the workers who take care of them. And it is long-term care facilities that are being particularly hard hit by the virus. Emergency preparedness, which should have been prioritized after SARS, is virtually non-existent in any meaningful support to the front lines. And it is within this context that we're seeing workers getting sick and dying. While employer WSIB premiums were just cut by 30%, there is now concern that even healthcare workers will have difficulties proving that their illness was acquired at work. Doug Ford's government cut funding to public health by 5% this past January, and we're now seeing that public health is playing a vital role in tracking and containing this pandemic. The short-sightedness of this decision and the dire need to overturn it cannot be more obvious at this time. And while COVID-19 has created a horrible situation, it also opens up an opportunity to call for funding for programs and services that benefit communities and result in safer working conditions. I hope you join me in our collective commitment to that fight for the next year.
Let me first say thank you for having the opportunity to speak with you today. My name is Jack Oliveira, Business Manager of Local 183, which has almost 60,000 members, most of which work in the construction industry. This is a somber occasion where we recognize those who have died or were injured or were made ill in performance of their work and or while working on job sites throughout Canada. April 28, 2020 is a National Day of Mourning to recognize and reflect on the lives that have been lost or seriously injured, all while performing work so that they can advance their own interests and the interests of their families by providing labor in return for compensation for their employers. This is not a time for idle reflection. This is the time for a call to action for all unions, for all workers, for all government officials, for all contractors. Everyone needs to do more and ensure that workers are protected to the fullest extent of the law. In my view, if one person dies or is seriously hurt on the job site in the province of Ontario, it is one too many. Providing for yourself and your family should not mean risking your life in the process. For far too many workers in this daily occurrence, many workers in this province are forced to work outside of legal requirements, the requirements of the Occupational Health and Safety Act, and outside of the law. This is something that we regrettably see far too often on many construction sites and workplaces throughout the province where our members work. Local 183 members will never forget 5 Italian immigrants who all died on March 17, 1960 while working on a water main tunnel in the area of the Hogs Hollow near 401 and Yonge Street, which later became known as the Hogs Hollow disaster. These men, immigrants, and vulnerable workers, like many of our members, lost their lives in a tragic and senseless way. Their deaths were not in vain and sparked a public outcry that resulted in the fundamental rewriting of health and safety labor laws and requirements in this province. More recently, in 2008, more than 1,000 workers lost their lives while working in Canada. The number was only slightly less in 2017, when more than 900 employees lost their lives. This doesn't take into account the countless numbers who were seriously injured and maimed as a result of senseless workplace accidents. The time is now to mourn the lives of those lost on job sites and fatalities over the past year, and we must take the time to reflect and use that as a motivation for what appears to be a disturbing pattern of complacency which exists in this province and throughout this country. We must act together. We must lobby together. We must fight together to ensure that better and safer measures are put in place for all workers, including those vulnerable than others, to ensure as much as possible the health and safety of workers in this province and in this country. I want to acknowledge the hard work of all Local 183 members and retirees who have done a fantastic job of ensuring all the necessary precautions are and were taken on job sites to ensure the safety of all workers involved. Local 183 has lost 5 members over the last year in workplace fatalities, and countless others have been injured. These men will never be forgotten, and they are by name Christopher Panapinto, Christopher Lesko, Diogo Felipe Horta Botelho, Zygniew Gorski, and Ricardo Almeida. The family of these members who have died in the last year need to know that Local 183 will not rest, we will not go away, and we will not stop advocating for further and better safety precautions being incorporated into the laws of the province, and that any and all violators should be vigorously prosecuted to the fullest extent of the law to ensure that workers have a better and a safer place to work in the weeks, months, and years ahead. Thank you.
Hello, my name is Catherine Hoy, and I'm the Provincial First Vice President of the Ontario Nurses Association, referred to as ONA. I am also a registered nurse. ONA represents more than 68,000 registered nurses and healthcare professionals, as well as more than 18,000 nursing student affiliates, providing care in hospitals, long-term care facilities, public health, the community, clinics, and industry. The National Day of Mourning hits very close to home for ONA. We remember registered nurses and ONA members Nelia La Rosa and Tekla Lynn, who died after contacting SARS while caring for infected patients. We remember registered nurse and member Lori DuPont, who was murdered while working at the Windsor Hospital. We cannot forget that healthcare workers continue to have some of the highest rates of injury and illness statistics in the workforce. This year, the National Day of Mourning is even more meaningful. It would be an enormous understatement to say these are very challenging and stressful days for our members. They are on the front lines in hospitals, long-term care homes, and the community, battling a terrifying virus that the world still knows little about. They are selflessly providing expert care to their patients, residents, and clients around the clock, while the number of COVID-19 cases continues to soar around them. They are also exhausted and terrified. Terrified they don't have the proper protective equipment that they need to stay safe so they can continue to provide care throughout this pandemic. Terrified of bringing this deadly virus home to their families. Terrified that they might not come home at all. Tragically, we already know that many of them have been infected by COVID-19. Even more tragic, it didn't have to be this way. The need to appropriately fund our healthcare system and value the work these dedicated nurses and healthcare professionals provide on the front lines was evident during SARS. We seem to have forgotten the #1 recommendation from Justice Campbell's SARS Commission report, the need to apply the precautionary principle, or erring on the side of caution when scientific knowledge is lacking. For ONA, this means that workers who are at risk of exposure must be equipped, trained, and drilled to use the appropriate personal protective equipment. We have had some success this far, but we will not stop fighting until every nurse, healthcare professional screening or treating suspected or confirmed COVID-19 patients in all healthcare sectors have access to the proper personal protective equipment. After all, if they're not safe, their patients, residents, and clients are not safe. So on this National Day of Mourning, as we remember those lost, made sick, and injured on the job, I ask that you please take a moment to also think about the nurses and healthcare professionals on the front lines fighting this pandemic for us. We owe them. We owe them our deepest respect and our gratitude. Thank you to everyone, and be safe.
Hi, I'm Tom Harkin, Managing Director of the Workers' Health and Safety Center. Today, our day of mourning, workplace COVID-19 exposures are killing workers and making many very sick. The Occupational Health and Safety Act says employers must take every reasonable precaution for the protection of workers, but in many workplaces that's not happening. The SARS inquiry's recommendations aren't always being followed. Government isn't always being transparent about how they're enforcing protections. You can get a $1,000 fine for standing too close to someone in a park, but if your employer says to do it in the workplace, there's no penalty. The Workers' Health and Safety Center was created to provide the highest quality training. We can't run training classrooms right now, so we've adapted. Every week, we're producing 2 or 3 30-minute webinars. You can watch past webinars on our YouTube channel. And they're there about cleaning and disinfecting, using your right to refuse, and applying the precautionary principle. And every day, for a couple weeks now, we've been running virtual classrooms, connecting instructors to workers just as we always do, with all the interactivity, still face-to-face with the buzz groups and the worksheets. And next week, we launch a really important new half-day virtual course, The Hazards of COVID-19. We'll discuss the characteristics of COVID-19 and review public and occupational law. And importantly, this course will help workers see how to apply distancing, cleaning and disinfecting, personal protective equipment, and other important life-saving controls to prevent COVID exposures. The need for worker protection against COVID isn't ending soon. Every workplace needs a COVID control plan for essential workers now and for all other workers as people start to be asked to go back to work. Please use our training and information to push for that control plan that protects you from COVID. In our proudest moments, we've done so much to make workplaces safer and healthier. Today, let's work closely together again to prevent more COVID exposures and to keep this virus from hurting more workers and all of us. Thanks.
This year's Day of Mourning, which remembers those killed by workplace injuries or disease, we are not able to gather in support in spite of social distances. We come together to comfort each other, to mourn for our loved ones, and most important, to fight for stronger health and safety laws in the workplace. On behalf of Toronto and York Region Labour Council, our 200,000 affiliates urge you to stay strong, stay focused on the task ahead. Recovery doesn't mean we forget. Let us continue to push the government and employer for stronger health and safety readiness in the workplace. We thank the essential duty workers, but it goes hands in hands with better equipment to do the job. Still we mourn mothers. Still we mourn fathers. Still we mourn brothers. Still we mourn uncles. Still we mourn our sisters. Still we mourn workers in the workplace. Workers go to work to earn a living, not to die on the job. Let's stand in solidarity with workers across the globe. Let's stand in solidarity with workers across the province. Let's stand up and fight for better protection in the workplace. Let's stay strong. Let's stand in solidarity. Solidarity, sisters and brothers.